Every one of us has to eat and drink to stay alive. That is why it is so important that our food does not harm us in any way. If you prepare food for others, then you have special responsibilities for safeguarding their health. You must ensure the food they are presented with does not cause illness, injury, or any other problems. Food handlers have a legal obligation to keep food safe to eat. This video will cover some food safety basics that all food handlers need to know. Food poisoning is an illness caused by the consumption of food containing harmful microorganisms or substances. Foodborne disease is caused by consuming food contaminated by harmful bacteria. An example of a harmful bacteria that contaminates food is Salmonella. Food poisoning can cause abdominal pain, diarrhea, nausea, vomiting, high temperature, and lethargy. The symptoms usually begin within 1 to 2 days of eating contaminated food. The main causes of food poisoning are poor personal hygiene, eating food after the use-by date, food pests such as flies, rats, and mice, not cooking or reheating food thoroughly, not storing food correctly, including temperature control, not cleaning kitchen surfaces and items thoroughly. Personal hygiene. Washing our hands is a normal and regular part of our daily routine. It's the most basic personal hygiene activity and is important for everyone, but even more so if you work with food. It's the first vital step in the disciplines and procedures that prevent illness. So why do we need to be so particular about personal hygiene when handling food? The answer is bacteria. Bacteria, including those that may cause illness, are found everywhere on our skin, in some raw food, and on pets and rodents. To keep bacteria from growing, it's important to maintain consistently high standards of hygiene, and because we have bacteria on our skin, personal cleanliness is vital. That's where hand washing comes in. We should all wash our hands regularly throughout the day, but particularly when entering a room where food is going to be prepared, before handling food and in between handling raw and cooked food, after eating, smoking, or blowing your nose, after handling any waste food or refuse, and most importantly, after visiting the lavatory. Spoilage and prevention. Gradually, all food will go bad through the natural process of aging. This is called spoilage. Some foods spoil faster than others, but the rate of deterioration can be controlled by preservation methods and safe food handling practices. Food spoilage may be accelerated by damage caused by careless handling, inappropriate storage, and contamination. The bacteria, yeasts, and molds that cause spoilage also need food, moisture, warmth, and time to reproduce. The same steps taken to prevent bacterial contamination are also needed to delay food spoilage. Covering food, cleanliness, temperature, moisture levels, and the length of time in storage all play a part in delaying spoilage and keeping food safe and appetizing to eat. In most countries, food must be labeled with a date indicating the period when the food is safe to eat. Highly perishable packaged foods, such as cooked meat, fish, and dairy products, must be marked with a use-by date in the UK. Any food that has passed this date is likely to be unfit to eat and could cause a foodborne illness. Food pests. Efficient pest control is vital in a hygienic kitchen. Pests live and feed on human food, and apart from being destructive, they're also dangerous because they carry food-poisoning bacteria. Pests include birds, as well as flies, cockroaches, rats, and mice. The best defenses against food pests include waste bins with lids, an efficient waste disposal system, storing food well and keeping it off the floor, and cleaning up any spills or food debris immediately. Preparing and presenting food. When you cook food, it must be hot enough all the way through for long enough to reduce pathogenic microorganisms to safe levels. As a rough guide, it is known that most bacteria are destroyed at temperatures of 70 degrees Celsius, or hotter when the core temperature is held for at least 2 minutes. Hot food passes through the danger zone temperature as it cools, so the temperature should be reduced as quickly as possible. You should aim to cool food to 5 degrees Celsius or colder within 90 minutes and then refrigerate it. Protect all food from contamination while it is cooling. Never place hot food in the refrigerator, as this will raise the temperature of the fridge and cause condensation that could contaminate other food. Some food may be cooked from frozen, but make sure you follow the manufacturer's instructions. Most raw foods, such as meat and poultry, must be completely thawed before cooking. Inadequate thawing often causes food poisoning. Always put the food you are thawing on the bottom shelf to prevent juices from dripping onto other foods and contaminating them. Reheated food is a common cause of food poisoning. Problems occur if the food is not reheated sufficiently, particularly if the initial cooking, cooling, and storage were inadequate. Remove food from the refrigerator just before reheating and serving, and not any earlier. Always follow instructions on prepared food. It is good practice to reheat food to a core temperature of at least 82 degrees Celsius for 2 minutes. If food does not get hot enough, you will provide bacteria with an ideal temperature in which to multiply. Never reheat food more than once and discard any leftovers of reheated food. Temperature control. The law concerning the temperature of food must be kept and was introduced to help control the growth of microorganisms and high-risk foods. When food deliveries arrive, they should not be left on the doorstep. Frozen food must be stored immediately in a freezer, and foods that require refrigeration must be placed there straight away. The dry store would normally be used to keep canned foods, fruit and vegetables, cereals, and other dried goods. Pasteurized tinned foods, such as processed meat, should be refrigerated. A refrigerator is used for perishable foods, such as raw and cooked meats, poultry, and dairy products. According to the Food Standards Agency, a fridge should maintain a temperature below 5 degrees Celsius, and this should be checked daily by means of a thermometer left permanently inside the fridge, and freezers should operate at a temperature of -18 degrees Celsius. Cleaning and disinfection. The process of cleaning something is to make sure it is free from dirt and contamination, and is essential if we are to keep food and the workplace safe. Cleaning aims to protect food from microbial contamination, reduce opportunities for bacterial multiplication by removing food particles, protect food from physical and chemical contamination, and avoid attracting pests. To prevent the bacteria from causing foodborne illness, some items and equipment must be disinfected after they have been cleaned. Disinfection can reduce bacteria to a low safe level. In general, you need to clean, disinfect, or sanitize food contact surfaces, including chopping boards, preparation tables, and work surfaces. Food processing items such as slicers, mixers, and mincers, also knives, tongs, and other utensils. Containers. Hand contact surfaces, including handles, doors, refrigerators, cupboards, drawers, taps, and switches. And contamination and bacterial multiplication hazards, such as cloths and mops and waste bins and their lids. Dishwashers provide an effective way to clean and disinfect items used in the preparation of food. Rinse cycles usually run at 82 degrees Celsius to 89 degrees Celsius. Always follow manufacturer's instructions. Items and areas where there are likely to be food poisoning bacteria, such as chopping boards, must be cleaned and disinfected frequently. This is commonly described as clean-as-you-go cleaning. It involves clearing and cleaning up after every task. There are 6 stages in most effective wet cleaning tasks. 1. Pre-clean, removing leftovers or soaking pans. 2. Main clean, washing with hot water and detergent. 3. Rinse, cleaning with hot water. 4. Disinfect, using a chemical disinfectant. 5. Final rinse, using hot water. 6. Drying, leaving to air dry or drying with a disposable paper towel. Drying cloths are not recommended unless they are washed and dried before every use. If you are ever unsure of how best to handle food in a safe and hygienic way, you can look at advice from the Food Standards Agency or the Health and Safety Executive, and you may also need to take a more comprehensive food safety course. The more you know and understand about food hygiene, the more you can protect yourself and others from food poisoning and foodborne diseases.